Thank you. This is a live Q&A session this afternoon, and we are joined by Samantha. For all of you who don't know Samantha, and I'm sure most of you do actually, Samantha has been a patient of mine for the last 2 years. We were on together on shut-ins last week, Monday evening, and where we discussed Samantha's weight loss journey. So you have Samantha with us now, and I'll ask Samantha a few questions. I'm hoping that this is all live, but if I'm not live, then you're watching it recorded. So hello Samantha, how are you?
Hello, I'm fantastic, thank you.
So let's find out a bit more about Samantha. Samantha, what is your current weight? And I think stones is fine, and our viewers will be very keen to know what your current weight is.
I'm 18 stone, 13 pound at the moment. I weigh less than I thought I did. So I'm really chuffed with that. As you all know, I was over 30 stone at the beginning of the process. So yeah, that's.
So you've lost, from my calculations, around 12 stone.
Yeah.
Over the last how many months? When was your operation, Samantha?
It was in the 18th of December 2019, my operation.
So just over 13 months, you've lost around 12 stone. So it's a stone a month.
Yeah.
So tell us, how has this weight loss journey been, and what difference has it made to your life?
The difference is amazing, to be honest. I'm not just saying that. I've had me down days just as much as me up days. Adapting to a new way of living isn't easy at the best of times, but the support I've received from not just Healthier Weight, but from my family and everybody else has been fantastic. And it's so nice to be able just to enjoy food for what food is meant to be for. So yeah, it's been a brilliant journey so far.
What about your physical capabilities? Are you able to, what difference has it made to your physical self?
Oh, I've changed so much. Before lockdown, we were in the gym as a family 4 times a week. We were going swimming a couple of times a week. We go walking. I do the housework, the cooking, the cleaning. Everything that I couldn't do before. So
be happy that you're doing the housework now.
Yes, I love it. I'm an OCD with cleaning, so it's nice to, get back into it and do it myself.
Excellent. And you're not getting tired, you're not getting breathless when you're working?
Nope. It's so nice to be able to breathe.
Now, one of the bigger problems that you had was idiopathic intracranial hypertension. And for those who don't know what this is, you had increased pressure at the back of your eyes, which used to cause headaches. And it used to, we saw in the program last week that you had to sleep out in the daytime sometimes when you had very bad headaches. You were on medicines for that. You were under doctors for that. What difference has weight loss made to your IH or your headaches?
It has made a bit of a difference. It is still there, unfortunately. But each day, each time I lose more weight, it is like decreasing a lot more. So, it's fantastic. I'm not having to be bedbound as much, obviously due to the pressure. The weather changing is just one of the symptoms that really pushed me over the edge. But, everything is improving so much each day. And, I'm so thankful.
That's good to know. So I think this IH weight loss journey, and we have seen it with many patients, will continue, and IH will keep on getting better. Of course, there is an element of IH which is not weight related, but the weight related part, the more weight you lose, it will keep on getting better. That is what we are seeing from you. Now, one of the very difficult things, and we saw it in the video, was that your liver was very thin before surgery, and that is because of the diet. But many patients find it difficult to comply with the preoperative diet before the operation. So how do you do that? How did you manage to lose so much weight before the operation that your liver was actually looking very shrunk and the operation became easier?
It was just a case of all the years I've tried to lose weight and I never have. And I knew I had the opportunity of a lifetime, in the palm of my hands. And obviously you were giving me a chance to change my life. And, the more I sat down and thought about it, I just thought I've got to give this chance an opportunity. And, once it was hard at first, but once you adapt around to the calorie counting and obviously the liver shrinking diet, I bark a bit now when I look at the yogurt, but I adapted well to it, and it's not easy. Nothing in life is easy, but it was worth it in the end.
No, I think the results showed during surgery, because your liver was it had shrunk in size, and it was easy to do the operation. It made it easier, and you had a great operation because of it. So thank you very much for doing such a good diet. And finally, this is almost the most important question I want to ask you.
Yeah.
Is there are a lot of patients who are in a similar position to you, in a worse position to you, in a slightly better position to you.
Yeah.
But they're quite hesitant, and they are not able to ask for help. And sometimes they don't know whom to ask for help from. So what advice would you give to all those patients who are in a similar position to you?
Just never give up. There's always somebody out there who'll help you, who'll believe in you. And, it took me such a long time of going back and forth to different people. But once you find the right people, you're on the right track. And, it was awful living in the body I lived in for so long and relying on food. But, I got there in the end, and having the right people trusting and believing in me, it made me believe in myself, which is amazing. And if anybody ever needs any advice or anything, I'm always just, Facebook or anything. I want to give back myself, and I'm hopefully one day I want to be running a support group and things myself, because I don't want people to struggle and suffer the way I did. It's not nice. And obviously larger people do, get a lot more stick than what an eating disorder, the opposite end of the scale, do. So, believe in yourself. You can do this. There's always some type of avenue you can go down. It doesn't have to be surgery. Even the mental health side of things. I didn't realize that just not dealing with my problems in the past was making me eat. As long as you try and deal with them problems, you'll go far. So yeah, that's the best advice I can give anybody. Just believe in yourself, and just remember to take one day at a time, one meal at a time. That's the best way I did it.
That's a fantastic advice, Sammy. So it's not just your physical health or your appearances, but it's changed how you think.
Yeah.
It changed your personal relationships, your social relationships, and it's changed multiple facets of your life, isn't it?
Definitely, yeah.
Well, I so much look forward to getting you back in Birmingham once all this.
I know, so nice to see you, because it just seems forever, doesn't it?
I think that I am really looking forward to that, and whenever that happens. But until that time, I think we have to isolate, quarantine, whatever.
Yeah, we do. We've all got to keep safe, and obviously, everybody will get there, as long as we all stay safe and, follow the rules. It's just part of what we're living in at the moment, isn't it? But We're all healthy, and we're all, taking it one step at a time. So, yeah.
That's brilliant, Samantha. I look forward to seeing you soon, and good luck. Thank you very much for joining us.
Thank you. Thank you for chatting. You take care.
Thank you, Sammy. Bye-bye.
Bye now.
Are questions coming in already? Do we know if there are people joining us, or? Okay, I can take questions, or should we get Van on right now? Okay, so let's take questions. So I think Mark sent me a link, or is there a live link for it? Okay, I'll go with Mark's link. Right, am I live again? Right, so we have a few questions that have come in. So let me go through these questions. First one is from Amanda. I have been on the list for 4 years. I'm finding it hard to lose weight because I've had severe back pain for the last 9 years. That is why I put on so much weight in the early years of back problem. How best to lose weight like this? I try and get far as 29 stone, and it all comes back. I have till April to lose enough for my surgeon to be happy, or I'm off the list. If that happens, I will never be me again, and I've missed so much. Amanda, I feel for you, and it's you are in a similar problem to Samantha had been. Samantha had been the same weight as you, more or less, starting weight of 30 stone. It is difficult. I think what patients need is the right kind of motivation and right kind of support. I'm not sure because I'm not talking to you live. I'm not sure what kind of system you are in or who you are with. But what I would advise is try engaging with the team that you have. If there is no team, then ask for somebody to support you through this process, because it is very important. You can't just lose weight on your own to get ready for an operation. I think you need a team around you. So request the team that you are with if they can support you through this process. If you are with us, then we will, of course, support you throughout this process and get you to the point that you need to be. But I wish you all the best. But I think just watching Samantha should give you a lot of courage that actually you can achieve good results with this operation with all the support. We have the second question, which has come from Sharon. I've had a gastric band for 12 years. I'm still struggling to lose weight and now have type 2 diabetes. I would like revision surgery to a gastric bypass. Can this be done in one operation? Sharon, I think there are two questions here. Firstly, we need to understand what went wrong with the band, why it didn't work, and we need to see if we can support you with that to get you back on track. But if finally we think that you can't get back on track, or maybe the band cannot give you the amount of weight loss you need to get rid of your type 2 diabetes, I think then we can start looking at other operations such as the gastric bypass. And to answer to your question, yes, the gastric bypass can be done in one stage, but you need the right team for it. A lot of surgeons do a lot of revisional surgery, or there are some surgeons who do a lot of revisional surgery. And I think in those hands, you'll be reasonably safe to have it all in one go. But I know that there are some surgeons who do it in two stages, um, but single stage is equally safe. It's not a problem, and we should be able to deliver that for you. So that shouldn't be an issue. We have the next question that has come in from Lynn. Would like to know about band sizes, why some surgeons stick to the same band size and place the port in the same area in all the patients they operate on. It's an interesting question, Lynn. Band sizes depend on the weight of the patient, on the amount of fat there is around the stomach, and on surgeons' preferences. What I can tell you is that most surgeons would try to put a small band or a large band, depending on the size of the patient inside. However, even if you do put a large band, when you inflate the band completely, the inside size of the band is the same as a small band. So you will get the same amount of weight loss. So don't worry if you get a large band and your friend got a small band, although you are the same size. There is a reason for it. But despite that, the weight loss would be the same, and I won't be worried about that. We have a question that is coming in from Catherine. At 240 kg and on NHS list for years, how long is the waiting for a procedure with you? Catherine, I'm sorry to hear that you have been on the waiting list with the NHS for the last few years. Unfortunately, the NHS is in a very difficult position and it's trying to do what it can to deliver the best for our patients. There has been a bit of gap with bariatric surgery at the moment. When you're 240 kg, there needs to be a lot of preparation for surgery. I mean, for some of our viewers, I can tell you 240 kg is around 35 stone. At that weight, I think it will take around 6 to 8 weeks to get you ready for surgery, because I will need to put you in touch with a specialist dietitian who will help you through the journey. But in 6 to 8 weeks, we should be able to do an operation for you if that is what you want. We will be able to cover more of this when Van, one of my colleagues, is on, and we will discuss about different diets and how we'll support you. The support you require when you're 35, 40, 45, 50 stone is different to the kind of support you require when you're 20 stone. I obviously, as you know now, like doing surgery on patients who are more than 30 stone, because I have a team around me which can support such operations, and that enables me to do such operations safely. Next is a message from Marion. I'm worried that meds I take for high blood pressure, etc., won't be absorbed. after gastric bypass. Marian, that should not be a concern. When we are assessing you, we are looking at all that. If you are on drugs that need to be changed, we will change that. If they need to be in a liquid format, we will advise you of the same. But your hypertension will be managed as it needs to be. So don't worry about that. But the good news is 2 years after surgery, 70 to 80% of patients will notice a dramatic improvement or complete resolution of their hypertension, which means they will not be hypertensive anymore 2 years after surgery. So you may not need those meds anyway. Well, let's welcome Van.
Hi, Rishi. Thank you for inviting me.
I don't think Van needs an introduction. Van is a very senior, I don't know how senior, a senior specialist dietitian, and a very good friend of mine, and somebody whom I've learned a lot from. And I think most patients know Van rather than me actually now. So Van should be the one who's introducing me rather than the other way around.
And it usually is, actually. It's nice to not be in the hot seat. It's nice to not be hosted. And you being in the hot seat makes a change. And when you say senior, I hope you're not referring to my age.
I didn't say anything. Van, I didn't say anything like that. You look younger than everybody else.
I know, but remember, Rishi, you must respect your elders.
Yes, Van, I have the utmost respect for you.
That's good. So I was just listening into your session with Sam, and wow, hasn't she had some amazing results?
It's absolutely amazing, Van. She's lost 12 stone in 13 months. Clearly, this means that she's engaged. But what do you think about that, Van?
Well, first, I mean, it's fantastic, and I'm sure she's really pleased with the results so far. It is quite quick. However, I always say, everybody's weight loss, you can't compare, one person's weight loss to another. And to me, it sounds, I mean, I've not worked with Sam. However, I know saw the documentary and well done on that. It was amazing. It gives us an insight into weight loss surgery and the emotions that people go through that we don't see in our consultations. But saying that, with my clients, I'm able to really access that sort of information from them. But I think she's lost a lot of weight pretty quickly, which is great for her. I would be looking to see how balanced her diet is to make sure she's getting sufficient nutrition, because sometimes, when we've been struggling with our weight for so long, it's very easy to get, to ride the wave of the weight loss, I say. And the novelty of losing weight after many years of not being able to lose that weight. You can override the fact that maybe you might be losing weight a little bit too quickly, but again, it all depends. The heavier you are, the greater that weight loss is going to be. I would hope that she doesn't panic when her weight loss starts to slow down and stall, because that's all part of the process of your transformation post weight loss surgery. But I know with my patients, it can really panic them when they start to stall or they have a little bit of regain, but that's all part of the journey. I mean, what would your thoughts be on that?
I think she's done incredibly well, and she has shown her motivation. But exactly like you, I think the diet needs to be balanced. As the weight loss surgery, as I tell all my patients, and I've learned this by working with you, that the first 3 years is the honeymoon period and you'll get a lot of weight loss. But during this time, you need to develop good habits. You need to start following a balanced diet, make sure that you're not becoming deficient in everything, and get ready with all the tools you will need to maintain weight loss after 3 years of surgery. Because that is when you will start seeing some weight regain, and a bit of it is fine. But our aim has to be to maintain the weight loss and follow a balanced diet. So it is very important to be in touch with a dietitian who can guide you over bariatric procedures for life. It's not for 2 years, and the help and support you need may sometimes have to go beyond that. So it is very important to be in touch with somebody who can guide you through this weight loss journey.
I completely agree, Rishi, and it's really great that you've said that the surgery is for life, because a lot of people, I had a question in my membership group actually recently, and the member said, what happens after 2 years? Does the weight loss stop? I said, well, most people generally can lose most of their weight within the 2 years. And we have those results for 2 years. And she says, well, what happens after? And I said, well, the reason why we have results up to 2 years is, especially in the NHS and most private aftercare, is the follow-up is only for 2 years. So it doesn't mean you stop losing after 2 years. It just means we may not have that long-term data. But I know in certain institutions like the NHS, we will try to keep collecting that data to see where the pain points start to happen with weight regain, etc. And I think that's really important to stress that the surgery never stops working. It's always working, but what's important is the patient or the client is working with the surgery for the long haul and not for the short term.
No, I absolutely agree with you, Van. So I have a question for you from Kerry. I have had my bypass 7 weeks ago and have started weight training. Sometimes I feel dizzy after training, and I'm therefore looking for dietary advice post-bypass on training days.
Right. Well, my first question is that I think at 7 weeks, it's too soon to be weight training. I mean, my advice always is that, you know, I don't tell any of my patients to do anything intensive until they get to their first actual long weight stall. And by that, I mean, they may have like 2 to 3 weeks where they're not losing any weight at all. My advice is always gentle exercise and just movement for the first, you know, couple of months. And I think that's really important, because if we go in all guns blazing and doing everything, when you hit those weight stalls, you've got nowhere to move apart from reducing your calorie intake. And ideally, we don't want to starve the body. So if she's feeling that way, I'd probably say, actually, this might not be the right time to be doing weight training. It may be more important that we start thinking about looking at your diet, you know, and what sort of non-weight training ways we can get you to be more active. So it might be just walking for a longer period of time, you know, and if she does want to do weights, which I'm a big fan of, because that's how we build muscle. So we build metabolism, as you know, but maybe do it later on. It might be that we need to be doing this at 3 months or 6 months. But right now, if she's feeling dizzy, that means she's doing too much. It's too intensive for her. So she needs to become more in tune to her body's needs, and she probably needs to eat that little bit more.
There you are, Kerry. That's fantastic advice from Van. And let's stay on Van. We'll ask one more difficult question, and then I'll ask
Thanks, Rishi.
Practical questions from Madalena. Does intermittent fasting work to boost weight loss 1 year after a bypass if I plateaued? I want to lose 20 more kgs ideally.
Right. Okay. So intermittent fasting, does it work? Yes, it does. Simple answer. Any diet will work if you follow it. The key is being consistent. So I think, you know, intermittent fasting is a fantastic way for sustainable weight loss when you start to maintain. So yes, intermittent fasting she can do. There's the hormonal effects from not feeding your body for a long period of time. So yes, she can do that. And did she say she's got 20 kilos to lose?
Yes, she wants to lose 20 kg.
How many years is she post-surgery? Sorry again.
1 year.
1 year, right, okay. At 1 year, I'd be really looking to see what the balance of her diet is, because she should be having still some good weight loss at around that sort of stage. So definitely an assessment, and intermittent fasting is fine. But again, you have to be consistent. It's got to be something that you're working with at least 80% of the time, because I get a lot of my patients or members saying that they've tried intermittent fasting, it didn't work. It did while they did it for about 6 weeks, but they need to think about the long term, that it has to become a lifestyle change and not just a quick diet.
Thank you very much for that, Van. So I'll come to a more surgical question from Amit. I had a heart surgery, had a bicuspid valve since birth, which was replaced in 2019. I fully recovered from that. I'm overweight. Age is 43, height is 1.72 meters, a weight of 109 kg. He says, would I qualify for weight loss surgery? Well, Amit, your BMI works out as 36.8. What we say is that if you have comorbidities, if your weight is causing problems and you're a BMI of more than 35 for a bypass or a sleeve, and you're getting things like joint pain, back pain, or mental health issues because of your weight, then you qualify for weight loss surgery. But most important thing is at least have a chat with a weight loss physician and see what they think about your problems, reevaluate them, and then you can take it from there. But it's not just qualifying for weight loss surgery. I think it's important to have a chat with a weight loss physician. And if you don't qualify, we will tell you. But there is a lot more than just qualifying for weight loss surgery. And I think we need to have that conversation with you at some point. So should we go according to a dietary question again so that I can prepare for the next one? Question from Mary.
Go on.
What should a diet look like 3 years after surgery?
Okay, very good question. and the first thing I want to talk about there is the word diet. So when I talk to a weight loss surgery patient or anybody trying to lose weight, when I say, what does your diet look like? They'll be thinking diet means restriction, low calories, let's cut out carbs, let's go on about 800 to 1,000 calories a day. It's all about restriction. It's all about that scarcity. When I'm talking about diet, I'm talking about how nutritious is your diet? Eat the rainbow, is it balanced? I'm talking about having food, lots of it. But somebody that is who is dieting will be thinking about restriction. So the first thing we need to say there is to avoid restriction. We're not talking about restriction. Someone that's around 3 years or if not 2 years post-surgery, I'd be looking for them to be monitoring what they're eating according to plate size. I don't talk about calories in and calories out in my consultations. I don't talk about the fact that you need to be on 800 calories or 1,200 calories. It's not about that. I look at your plate size. So you should be keeping to a 7-inch side plate to control your portions, of which a good third of that plate needs to be protein. That's your meat, chicken, and fish. A good half of it needs to be your vegetables and salad. And the smallest portion on that plate needs to be your carbs. So that's your potatoes, rice, and pasta. Now, that can be just under a quarter. It could be around a quarter of a plate. Now, if you can eat that sort of balance at your main meal and something similar at lunchtime, your breakfast could be just something like a slice of toast, a small slice of toast with, make sure you have protein with it, like a boiled or poached egg, or it might be a small bowl of cereal with yogurt or milk. So eating three small meals a day, really. And that's what a general diet should look like at around 3 years. Now, a lot of patients might panic with that, thinking, gosh, I'm eating too much. And a lot of patients do experience weight regain at around 2 years and 3 years. And the reason why that happens is more because the old habits have just crept back in. So they may, they'll be eating off a larger plate. Now, if you eat off a larger plate, there's psychology there. You want to fill that plate. You've been told all your life, clear your plate because there's children in the world starving. But, you clearing your plate isn't actually going to help them, believe it or not. So if you keep to a smaller plate, you're going to be able to control those portions. And the other thing about eating off a smaller plate is that, you're not just only controlling your portions. If you eat off a larger plate, the eye is seeing lots of space on that plate. And all it's going to do is send you lots of hunger cues that you need to eat more because you've been a little shortchanged on your plate. Whereas if you're eating off a smaller plate and, the plate is full, but it's smaller, the messages to the brain are very different. They're all fullness. There's too much weight there. How are you going to manage it all? So we need to make sure portion control is the way forward. So 3 small meals a day. And you might need high protein snacks if you're struggling. Otherwise, generally just the 3 main meals a day and snacks only in between if you need to get that extra protein in.
Van, this is good advice for everybody. I think this is not just for a patient who's had surgery. I think, I dare say I'll try.
I was about to say, Rishi, I wonder if you need to take on a bit of this advice.
This is lovely advice, Van. I think whenever I talk to you, I gain something. I'm getting a lot from you.
Rishi, you've learned so much for me, and I know it's really painful you to tell me this.
I know it pains me. We have a very interesting question from Lisa, not dietetics, not surgery, it's in the middle. Lisa asks us, Lisa Turner, why is it so expensive? I've tried to talk to my GP. She's referred me to a weight loss doctor, but because of lockdown, I'm still waiting to be seen. I suffer with arthritis and considering abroad. Now, usually you ask me this question. I'll start by saying that, Lisa, why is it so expensive? If we break down an operation, I think there are many steps of an operation. There is the preoperative care, the operative bit, and the aftercare. The operation part, a lot of it is based in the hospital. You are in hospital for a couple of days. You have an operation. The instruments have to be used. You have to use a stapler, staples, and all of these things are disposable. A lot of these things, and they add up to costs. The aftercare is a very important part of your journey. If you just do an operation and don't support you post-operatively, you will not lose as much weight, or I dare say you will hardly lose any weight if you're not being supported post-operatively. Support is a very important part of your journey. Support with a dietitian, support with a bariatric nurse. All those things are very, very important to get the maximum out of your weight loss journey. So I do accept it is expensive, but It is expensive because there's a reason behind it. You have so many people who are supporting you. You have in surgery being done in good hospitals where expensive bit of instruments are used that are disposable. And as a result, the surgery becomes expensive. Now, I accept that the surgery abroad may be cheaper, but that has its own dangers. We do hear of stories which are published in the Sun, and I don't believe in the Sun completely, but when you go abroad and have surgery, you are not necessarily going to the best surgeons there. You are going to somebody who's advertising the best, but that doesn't mean they are the best surgeons. You don't know whether the instruments are sterile the same way that we use in UK. Are they being used disposably? Are you following the same corona or COVID restrictions when you're having surgery there? And do you have access to an expert dietitian as part of their package who can actually see you face to face if required? So all those things are important. But Van, what do you think about support? What do you think about aftercare? How important is it?
I think it's really important. I mean, we talk about this quite a lot in the Facebook lives that we do, and we always done. I know this pains you to hear this, but but I have to say it. I'm very frank about this. That surgery does about 30% of the work controlling physical hunger. That's the hunger that you get when you wake up in the morning for your breakfast, at lunchtime, and in the evening. It's for survival. The bit that surgery can't do is the emotional aspect of eating. So your relationship with food, we've got to look at weight loss holistically, and that's why aftercare is important. So we need to look at your stress levels, sleep levels, your nutrition, your activity, and also your motivation levels, and your relationship with food. And that's 70% of the work. And what everybody has to, patients that sign up for surgery have to remember that, just like we started off with, the surgery is for life. So it's a tool, and you're going to have to make sure that you've got the right toolkit. And the toolkit is about having the right surgeon, if you're having it done privately, the right company or provider, the right support, not just pre-surgery, but post-surgery. But I really do believe that also, what's really important in the entirety of the care of the patient is managing their expectations. And I use this analogy on my patients, Rishi, you might like it as well. So I say it's like going to a supermarket and buying, not that weight loss surgery is a can of beans, but this is a simple way to explain that. You buy your can of baked beans, they're branded Tesco's or Sainsbury's or Heinz, whatever brand it is, and it's tinned and it says in tomato sauce. You get home, you open up the can of beans, and all of a sudden, it's not in tomato sauce, it's in barbecue sauce. But if you actually read the information, it said on the can that, oops, sorry, occasionally you get barbecue sauce. And the last thing what I'm trying to explain here is that you've got to make sure what you sign up for, you understand. And if you think the surgery is going to be that silver bullet to weight loss, you're in for a big shock, because it isn't. It is, it's 30% of it's going to help you. The other 70% is you with great aftercare, to help you work with that tool. And you've got to also remember that, when you get to the point of having weight loss surgery, you've been trying to lose weight, you've been on and off a diet for most of your life. So don't expect your habits to change over life. And that's why I always say, like with my support, it's all about coaching, it's about therapy. Sometimes we don't even talk about food, because really the reasons why we eat emotionally are not even related to food. It's a habit that we've created to soothe those negative emotions. So support is invaluable. It's necessary to get you to where you want to be. It's like driving. You can sort of learn to drive without an instructor, but really you're going to really pass that test? Possibly not. But to be a safe driver, you need to go through the process.
I think you're so right, Van. I think, so to answer Lisa's question, you need support after surgery, and support 24 hours a day, support every day of the week. It does cost, and that is why your surgery is so expensive. It does cost to do surgery in a decent hospital, to use good instruments, to use disposable instruments. All that adds to cost. I would like to see the surgery being offered free to everybody on the NHS, and that's what I would like. That nobody really has to go private unless they really want quick surgery. But you should be all able to get surgery on the NHS. But until that dream has been achieved, I think you'll have to pay for having good operations, and that's unfortunate.
And I
No.
think, Rishi, I know you've done a lot of research about the pandemic, and how it's affected surgery. And I'm sure in the NHS it has been affected. I mean, we had long waiting lists of around 18 months to 2 years, and I'm sure those lists are even longer now. But people might be questioning, how safe is surgery during the pandemic? And I know you've done some research on this, right?
Thank you, Van, for reminding me. My research, which has now been published in Lancet, and that's a very big medical journal, shows that bariatric surgery is safe during the pandemic as long as protocols are followed. Protocols of self-isolation, protocols of testing, protocols of being in a green hospital, so having a pathway, and protocols of post-op isolation. So as long as you follow protocols, it is safe. And just to talk about that, if you wanted to go abroad to have surgery, first you will need to isolate 2 weeks after you reach abroad, wherever it is. Then you need to make sure that the hospital is a green hospital, follows green pathway. And then we noticed in our study that a lot of patients were getting post-op infections. So ideally, you need to isolate 2 weeks after the operation. So you need to be in this country, wherever it is, for 4 weeks in a bed and breakfast, not in a hotel, because you can't isolate in a hotel. You need to be in Airbnb kind of an accommodation, and for 2 to 3 days in a hospital, and make sure that there are only green pathways in this hospital. And I think then it is safe. But we are doing all this in UK, which is also adding to costs to an extent. Now, Michelle has sent us a question. Hi, how many calories should I be on a day as struggling to go more than 800 unless eating rubbish? I don't understand this question.
Well, I'll answer that first part of the question. Well, first of all, I think 800 calories is low for anybody.
Yeah.
And so, you said you're struggling. So does that mean you're struggling to eat, or you're struggling to keep to 800 calories? I don't know what you're trying to say there, but I would say 800 calories is low. You're probably not meeting your protein requirements. And it's very difficult to give specific advice when we don't have any of your medical or health information in front of us. So if you're struggling, I would recommend that you eat little and often, and make sure you have, your snacks are in between. So you have high protein snacks. Now that might be a glass of milk, a small tub of yogurt, might be a milky coffee, it might be a boiled egg, might be some smoked salmon and cream cheese mixed together, but we need to be looking at that. So I think that's all I can say, but 800 calories does for me sound low. For a lot of people that have been trying to lose weight for months, they might be, or years, that'll probably be an average intake. But no, you don't want to be starving on 800 calories, because you might find that you're going to end up with a huge weight store.
So lots of live questions coming in. Thanks, Fan, for that. Lynn, can I ask if it's common not to have any more contact with the surgeon since before op? My surgeon didn't even come to see how I was after my surgery, and I felt disappointed. Lynn, that is unfair. Well, I don't know the exact circumstances, but all the surgeons that I work with, I know they will see their patient after the operation. I make it a habit to talk to all of my patients for 10 minutes, 15 minutes before the operation. We sit down, we chit chat, we discuss all the operations, half an hour, however long it takes. And after the operation, I will see all patients at least once, maybe twice, if required, more. My anesthetist will see you post-op. And that is the ethos that I've tried developing across our company. And that is a general surgical ethos. Was there a problem with that the surgeon had to see another patient? Was there an emergency? I don't know. But this wouldn't be routine. I think you would be seen as much as you need to be seen around the time of operation. Preoperatively, I can't see you, but I will talk to you, because we just can't see anybody these days. And I say post-op, after being discharged from the hospital, if you don't see me, it's a good thing. If you want to see me, you can. But if you're seeing me, then there's a problem. So post-operatively, if I do 500 patients a year, I see probably 1 or 2 who want to see me for some specific reason. But I don't have to see you if you don't need to be seen. But if you're seeing me, then there's a problem. Anne has asked another question. When do I expect to hear from a dietitian after surgery? My op was the 5th of January, just wondering. Usually it is 7 to 10 days that we have nurses supporting. What is the general idea you can give, Van?
Yeah, I think with healthy weight, usually there's a call a few days post-surgery, and then 10 days, and then it's 6 weeks, and then every 3 months. believe it or not, I'm not included in the aftercare support with healthy weight. So it's an extra add-on if you want me included. So there wouldn't be a dietitian call, but you definitely get a nurse calling, one of the bariatric nurses from Healthy Weight calling you to support you.
All complex patients are referred to VAN anyway. So as part of Healthy Weight service, anybody who has complex problems, is having revisional surgery, is having surgery when they are more than 60 or 70 BMI, 250 kg, you'll all be with VAN anyway, and she will be supporting you through this process.
Yeah.
Nazia has a question. I had a band done 2 years ago, but still overeat. Would the gastric bypass be better for me? Now, I'll ask Van to answer that question first, and then I'll answer that question.
Right. So before Rishi even gets his hands on you, I'd want to assess you, because we need to make sure, you've had surgery 2 years ago. It's not that long ago. First of all, we need to make sure, how well are you working with the surgery, but how well is the surgery working for you? So we need to think about that. And remember when we were just talking about, surgery in general, like I said, it does 30% of the work. The other 70% is you, looking at all aspects of weight loss and lifestyle changes. So we'd need to assess that, but also your relationship with food. No surgery is going to change your relationship with food. Now, the difference between a band and possibly a bypass is that people think a gastric band is going to give you restriction, but it doesn't. It's more of a regulatory device. And if you work with it correctly, it will help control your portions and you'll feel satisfied. Whereas with the bypass, which is a little more invasive, you're going to get an element, you will get restriction because you've got a smaller stomach pouch, but you'll get that restriction only if you work with it. But also there's a hormonal element when you have a bypass, so you don't feel as hungry. However, an element of that hunger will return. Now, part of it will be head hunger. So you'll want to eat, nothing can control the head hunger, but some of it will be actual proper physical hunger for survival. So, and not to panic when that does return. So that would be my take on it. You need an assessment first before you just jump in for surgery.
I'm completely there with Van. And what my practice always is, when I see a patient in the clinic who's had a previous band, I will not revise it anyway if it's less than 2 years, because I think we need to give at least 2 to 3 years to everybody to make it work. But then I will assess you. If I surgically think it is the right thing to do, then all my revisional patients are referred to Van, and Van has to assess them as to how are they doing with whichever operation they've had. Have they actually failed? And failed is a very bad word. I don't use band failure in my discussions. Have they not achieved what they wanted to achieve is a better way to put it. And are they going to benefit with another operation? So we assess you independently. And if both of us agree, and then we have an MDT discussion that actually you will benefit from another operation, then we think about it. But the first thing is, where are we? And is there anything that I can do to help you exactly where you are before revising an operation? Because an operation is an operation. And I do a lot of revisional operations, but I would be happier if all my patients did not need a revisional operation. And I could make the existing operation work somehow. And I'll be happy with that. And all of us would be happier with that.
I think another thing is that a lot of the revisions are with patients that, had surgery many years ago and the band was the only option, So, yeah, you've only had it in for a couple of years and we need to, and again, did you have the band placed in the UK? What sort of support have you had? Have we failed you with support? So we need to look into that. So, yeah, don't rush into a decision. You need to be assessed first.
That's absolutely right, Van. And question from Sam. I'm waiting on my new date for my sleeve in Glasgow. Are there any updates for Glasgow resuming surgery at Ross Hall? I can't afford to come to Birmingham. Thank you. I genuinely feel my life is on hold.
Oh.
Sam, I'm so sorry, but we just don't know. Nobody knows. I think Boris is the only person who knows how this is going to go. I think hospitals will open up soon. I'm hoping that there won't be, and we are all hoping and praying that there's no third wave. And I think April, May, hospitals should start opening everywhere, probably even March. So hold on, and we are here to support you. A question from B. 1 month post lab ban due for my first fill this coming Saturday. I do hope that my weight loss will kick off then. Is there a normal increase in appetite before the first fill? Oh, this is a tricky question. I don't know the answer, Van.
Yeah, you are likely to feel hungry. And if it's your first fill, you should be at least 6 weeks. And what's starting to happen is you've been on the liquid phase, the puree phase, the soft phase, and you're now starting to progress to solids. And because you're losing weight, there's a fat pad underneath the band, and that will start to shrink. So the band will feel a little looser. So you're not going to get the full effect of the band. So this is a sign to say that you're probably ready for your first fill. But ideally, if you're sticking to the firm textures, because that's how the band works to its best, you're probably ready for a fill. Now, if you're having soft, sloppy textures, then it could be that you need to firm up your textures first before you have your fill. So just check that out. But generally, most patients are ready for the first fill at around 6 weeks. And also, where are you guys doing adjustments? Because they're like gold dust.
Well, very good question. This was a question coming up from another patient of ours. I can't remember the name of the patient now where I read this question, but band fills, yes, I have the name here. The question from Just Jeep, where do we do band fills? Because of the government advising us that we should only do essential work.
Yeah.
We are not doing band fills, but only unfills at the moment. So if the band is too tight or there's a problem, we will aspirate your band. But we are not doing routine adjustments till the lockdown is over. So once the lockdown is over, then we will be able to get you back in and do adjustments for you. But we cannot do adjustments at the moment. We can only remove fluid or give you advice on the phone at the moment, because not that we don't want to, we have all the nurses who are raring to go, but the government just won't allow us to do those things at the moment. Now, Jill has an interesting question, more surgical. There are some dietary aspects to it as well. So we'll ask Van about those. What is the difference between a Roux-en-Y gastric bypass and a mini gastric bypass? First thing, a mini gastric bypass is not a mini gastric bypass. I like calling it mini because it's a nice name, but it is actually a one anastomosis gastric bypass. So a Roux-en-Y gastric bypass has 2 joints, a mini has 1 joint. First difference. They take more or less the same amount of time in good hands. They should both take less than 1 hour. What is the difference to me as a surgeon? I prefer to use the mini or the one anastomosis gastric bypass in patients who are more than 30 stone. All of the patients who are more than 30 stone, I try using that. In all patients who are having revisional surgery after a 50 BMI or 25 stone or so. And in other complex patients where I need a much more powerful effect. So the bottom line is that we believe from all the data we have that the one anastomosis or the mini gastric bypass is a more powerful procedure. You get more weight loss, but it comes at the expense of a bit more anemia and a bit more protein loss. And now I would like to ask Van, we give our standard supplements to all of these patients, which is iron and vitamins and B12 injections and vitamin D and calcium. But what more do you need to do with mini gastric or one anastomosis bypass patients, knowing that they will get more anemia and protein loss?
Yeah, so, it might be that they need to have more snacks between their meals, and it might be some advice that they need to carry on for life, that, just to make sure that they get that protein element in. Supplement wise, it's usually the same, but, I'm very much a person, but if we see something dropping in your blood levels, then we need to work on it with your diet and extra supplements. And that's normal for any procedure. So really the advice is pretty much the same as a gastric bypass, but we may just need to look at that protein element a bit more and really focus on that.
Thank you very much for that, Van. And my God, it's a very, very complex question. I can't even understand.
I'll let you take that one then.
Oh, this is for you. From Vicky, I am 4 months post-sleeve and averaging 65 to 70 grams of protein and 1100 calories a day. I'm experiencing hair loss and taking all my nutrients as well as fluorescein recommended by my pharmacist. Should I be doing anything else? And how long do people usually see results in hair growth? Right. I'm very happy with my weight loss. I'm 6 stones down. No, it's not complex. I can answer some of it, but I'll let you answer the majority of it.
Okay, so look, hair loss is normal after weight loss surgery. The trauma of the actual surgery, you're already watching your calories pre-operatively because of the liver shrinkage diet. And then you go through a good 3 months of not eating very much. So hair loss is very common. Hair growth, there's a cycle. So again, your hair will regrow, and you might find like short bits of hair growing back right at the front of your head at around maybe 6 to 9 months. But you might also experience a lot more hair loss during that time. Nutrition wise, I always say make sure you've got a good protein intake. You're eating sufficient calories, so 1100 calories might be a little low. You might need to up it a little bit. You know, follow the guidelines of that small plate and a good plate, a third of your plate being protein. Make sure you're taking all your supplements, iron, your B12, vitamin D, again, it affects hair loss. So make sure you're taking all your supplements and your B12 injections. And I know there's a lot of talk about biotin and should we be taking it? There's no clear evidence to say biotin is going to make your hair grow back any quicker. So a balanced diet, taking all your supplements, and just to accept that hair loss or your hair thinning after weight loss surgery is very normal, but you should start to experience some hair regrowth at around 6 to 9 months if you've started losing it before that time.
So would it be right to say, Van, and I think I know the answer, but any quick weight loss, whether it is surgery or diet, any quick weight loss will cause hair loss, but it is only temporary. And it is not hair loss, it is hair thinning. It is, and if you do a very, very drastic diet, you will see the same thing and it will just grow back again eventually.
Absolutely. Yeah, absolutely.
Well, it wasn't that complex, Van. Thank you very much.
Wasn't for you, no.
How long does a gastric band last? So it's a very quick question. I can answer shortly. A gastric band is for life. Obesity is a lifelong problem. It's a permanent problem. So the treatment for obesity has to be permanent as well. And it's not just the band, it's all that goes with the band that you have to maintain. You have to keep your guards up. This is like a battle that you're fighting. And we have just provided you with a tool to fight the battle, but you have to continue fighting it. You have to keep your guards up. You have to follow the advice off and on, even in the longer run, visit your dietitian, talk to your nutritionist, and keep maintaining that engagement. This is a battle that you have to keep fighting at a slower pace. In the first 2 years, maybe it's a major battle, but it's a smaller battle that you have to continue fighting.
Rishi, I've got some questions for you.
Oh, yes.
Oh, I can take over now a little bit. I feel better. Feels really different, you being in control. Right. So, and we've had, these are questions from some of my group members. So, Tamsin asked, why do they keep the stomach in place with a bypass, but remove it with a sleeve?
Very surgical question, interesting question. The mechanism of action of both sleeve and bypass are different. In this sleeve, we are taking 80% of the stomach away because that secretes ghrelin, and ghrelin is the hormone that makes you eat. That is how the sleeve works. There are other changes that the sleeve brings about as well, such as metabolism of your bile, but that's the main mechanism. In the bypass, you leave the stomach behind because you're bypassing a small portion of the stomach. And that is why you don't need to remove the stomach. But then I argued as a junior surgeon that why don't we remove the rest? Well, there are two very important reasons. Firstly, the risk of major complications and dying from a bypass is less than 1 in 1,000. There were studies done in Southeast Asia, Korea, Japan, that if you remove that part of the stomach, that risk will go up to 2 per 100 patients. So from 1 in 1,000, the risk of major complications will go up to 2 in 100 if we remove that rest of the stomach as well. And that's a very high risk. We are almost increasing your risk by 20 times. So it's not worth it. That's why we don't remove the rest of the stomach, unless you are somebody who has a high risk of developing a gastric cancer, in which case I will remove it. And I've done it a few times. Secondly, what they noticed that if you compare bypasses versus standard bypass versus patients who've had this part of the stomach removed, the weight loss difference is slight in the first 2 years, but then the weight loss equals out in both the operations. So you may argue that you can remove ghrelin as well, but if you remove that part of the stomach, and that is correct. That may improve your weight loss slightly for the first 2 years, but that will equal out after the 2 years. So you have taken an additional risk for no additional benefit.
Right. Okay. I've got another question for you. So this is from Anissa, and it says, what's the facts about stretching your stomach with a sleeve? And how do you know if the stomach is stretched? I think this is both a dietary and a surgical question.
Yes. you can stretch any operation. No operation is a magic bullet. Okay. If you don't work with the dietary advice, if you don't work with your operation and support your operation, your pouch can stretch, whether it's a band, whether it's a long narrow sleeve, or whether it's a bypass. You can stretch any of them, and it is very important. And there'll be a bit of stretch, but you have to keep your guards up all the time so that you don't stretch it, because the more you stretch it, the less results you will see from your operation.
Yeah. And on average, I mean, how often, I mean, how quickly can somebody stretch their pouch?
Well, you and I have seen, Van, that some patients can start stretching the pouch 6 months after surgery. If
Yeah.
they don't listen to advice. So it is very important to be in the right place and be ready for surgery. A lot of patients may need surgery, but they may not all be ready for surgery. So you need that relationship with your team to be assessed by a surgeon, sometimes a dietitian, a psychologist. We all need to assess you. And that is why it is very important going to a provider that has a big team, that has a dietitian, a psychologist, a bariatric nurse, a surgeon, a diabetologist, or a diabetes doctor, a cardio, all those people you need who can assess you and support you. You may need surgery, but you may not be ready. And it is our job to get you ready for surgery so that you can get the best possible result and support you through this journey.
Yeah, and I think, you know, stretching a gastric bypass pouch or sleeve pouch is one of the most commonest fears of our patients. And they're really scared, and they think that they've, you know, even after 2 weeks of surgery, and they may have just started the puree diet a little bit too early, and they might think, oh my God, have I stretched my stomach? No, it does require a lot of effort to stretch a stomach. And you have to remember that the stomach is a tissue, and it is going to stretch a little bit each time that you eat, but it then shrinks as well. The only way that you can stretch a pouch is if you're eating and drinking together, because your stomach can't accept the delivery of both sort of texture, that volume of food and water together. So you could stretch your pouch that way. If you're drinking a lot of fizzy drinks, which we always recommend that you avoid fizzy drinks because they make you feel uncomfortable and they can stretch your pouch. So to be mindful of that. And a lot of people might think they've stretched their pouch, but they haven't actually, because they notice that when they're having liquidy and sloppy food, they can eat more. But that's why I always say, when you eat firm textures, because the food sits in your stomach pouch for a lot longer, you get that fullness sensation, which is great, which is what we want you to have. But the thing is when you're eating more firm, dense textures, you've got to eat slower, you've got to chew your food, it takes more effort. So what will happen is maybe 6 to 9 months, maybe even 12 months after surgery, you'll find that some of the old habits of eating quickly start to come in. And you notice that actually when I eat something that's soft in consistency, like a shepherd's pie, compared to a lamb chop, what you'll find is the shepherd's pie is a lot easier because it's nice and soft. You don't need to chew it as much because it's already partially pre-digested. So you might start to think, oh my God, I can eat so much more, but really it's just that you're not working with the surgery and you're not eating the right texture. So it's difficult to stretch a stomach pouch, but you can overstretch it if you haven't got the right support and you don't know what you're doing. And that's, again, you know, both surgeon, dietitian, and a whole team there. Have we got time for a few more questions? Another question?
Should I ask you a short question? It's a
Go on then, go on.
Annie says, I've heard there's a link between weight loss surgery and gallstones. Is it true? I'll answer this quickly. There's a link between weight loss and gallstones. It's not weight loss surgery. Any weight loss can cause gallstones. It is not band or bypass or sleeve or whatever operation. It is weight loss, and that can cause gallstones. If you do develop gallstones, there are ways to manage it, so we can discuss that. Over to you, Van. Next question.
Right, let's see. Oh, I'm just trying to pick out a nice one here. Oh, I know which one I think will be good. It's both diet and surgery. If a sleeve is stretched, can you see that there any theme here about stretch pouches? If a sleeve is stretched over time since surgery, are pouch resets effective in any way? And this is a question from Victoria. What's your thought about pouch resets, Rishi? Because I know what my thoughts are.
I don't want to be very damning of dietary techniques. I'm with a dietitian sharing the diet, so I can't say some things. I won't say black and white, but if your sleeve has stretched, if you think it's stretched, or if it is actually stretched, you need to work hard to keep it there. I want you to succeed in your current operation. I do not want to revise any operation if I can avoid it. I want you to succeed with what you have. You need more support, more help, maybe we can salvage the situation. But if you do need resizing surgically, the option is not a re-sleeve. That will never be an option. I don't think that works. And the entire world literature on revisional surgery says it doesn't work. It will have to be a mini gastric bypass or a one anastomosis gastric bypass. I think that is all that's going to work if surgery is required. But before that, there is more help. There is more support.
Yeah. And with regards to patch resets, no, they don't really work. You can go, I always say, go back to basics. You know, if you want to go back to the liquid phase and progress through textures, that's fine, because it sort of resets you mentally, but you can't reset a patch. You can't shrink the tissue of the stomach. Once it is stretched, it is stretched. You can go on to liquids and you can pay thousands or if not hundreds of pounds to do a patch reset. It doesn't work. It's all about working with your surgery, and that's a great point to, you know, to end at, really. Work with your surgery.
Lovely. Well, if all of you have loved Van, and I'm sure all of you have, we'll get her back on again. We all love Van. We talk to her. It is so nice talking to her whenever we can meet her. So we'll get her on again, but only if you vote that, well, I don't think there's a voting system. If you message us that you want Van back, we'll get Van back on for you.
Oh, I'd love to. And thank you ever so much for the invite. It's great, but, you know, another way to connect with Rishi is in the Facebook group that I've got as well. We try and do some regular free support once a month, once every 6 weeks, just to answer questions very similar to this. But, you know, maybe YouTube might be a better way to, and Instagram to sort of help more patients out there.
Van, it is always lovely having you. Thank you very much.
No, thank you. Thank you very much.
We're done. We're signed off.
Oh, thanks. That was really good. I really enjoyed that.